Hi there, welcome back to Amaize Health as we continue the journey to amazing health. I'm Dr. Thorpe Amaize. Thank you for joining me today. This month, we're discussing contraception options. There's so many options out there, both hormonal and non-hormonal, and we'll go through each. This week, we're going to start off talking about non-hormonal birth control options. Now, we won't be including the copper T, which is the non-hormonal IUD. We'll talk about that in another video. So this week, we're actually talking about condoms, diaphragms, the vaginal acidifying gel, spermicides, and even the withdrawal method. So these tend to be less effective in comparison to some of the hormonal options such as IUDs, but they have their place in terms of protecting us. Let's go through each one, starting with the external condom, or what most of us think of as a regular condom. Now, when you use these, you want to use them every single time you have sex. If you're allergic to latex, there are polyurethane options, and you can buy these at many drugstores. You can use condoms to protect against STIs and HIV. And of all the options we're discussing today, an external condom and the internal condom, which was previously considered the vaginal condom, these are the only two that are effective against HIV. All the others are not. So to protect against HIV, even if you're using another form of contraceptive option, you want to also use a condom. So in terms of using an internal condom, you want to use that each time you have sex. You can use extra lubrication as needed. You want to use it for both vaginal and anal sex if necessary. And then they're good for people with latex allergy because they tend to not be made of latex. It can decrease penile sensation though, and maybe a little bit noisy or maybe a little hard to insert. And sometimes they can slip out during sex. And so that's part of the reason why they tend to be not as effective as the external condom. Now, moving on to diaphragms. The diaphragm you want to put inside the vagina each time you have sex. You use it with spermicide every time. It can last up to several years, costs very little to use. It's another one of the options that you can get over the counter, but does not protect against HIV. If you're having any kind of vaginal bleeding or infection, this is not something that you should be using. So for the next option, the vaginal acidifying gel can be inserted each time you have sex also, can be used as part of like foreplay, does not have any hormones as we described, but this one does require a prescription, so you are not able to buy this over the counter on your own. For some people, they do complain of irritation of the vagina or the penis. And if you feel like you're having any type of infection going on, then you also should not be using this one. There is in addition vaginal spermicide, which comes in creams, gels, sponge, foam, inserts, and film, that is to be inserted each time you have sex. You can purchase this over the counter without a prescription and may cause some irritation to the vagina or penis. The key thing to remember with this one is that it may increase the risk of getting HIV on its own, but when used in combination with a condom can help to prevent contracting HIV. Then the last option is the pull-out method or the withdrawal method, which is basically pulling the penis out of the vagina before ejaculation. So, it costs nothing to do this. However, it can be less pleasurable for some people, and it actually does not work if the penis is not pulled out in time. So you must interrupt sex in order for this to work. And many people don't know the right timing. So I actually typically would not recommend this as an option for people who are, again, wanting to protect against HIV, people who are not in committed relationships and are very concerned about getting pregnant. Those are all the non-hormonal options. So the three takeaway points that I want you all to remember is that most non-hormonal birth controls are based on the user, which means are you using it effectively the way that you're supposed to use it? If you don't use it effectively, then basically it doesn't work as well. The next point is that only condoms and of course abstinence, but only condoms can protect against contracting HIV. And most non-hormonal contraceptive options are over the counter and can be purchased without a prescription except for the vaginal acidifying gel, which does require a prescription. As a reminder, this is not a substitute for seeing your doctor for an appropriate evaluation. I do want you to come back next week because next week we'll be talking about other birth control options or other contraceptive options. And as we continue on our journey to enjoying amazing health. If you want to book me for a speaking engagement, follow us on social media platforms, Twitter, Facebook, LinkedIn, Instagram, at Amaize Health, or you can visit the website www.amaizehealth.com. Be sure to like and subscribe, and as you listen, again, this is Dr. Thorpe with Amaize Health. See you next time.